I'm going to talk about two things. One is London's experience so far of the Better Care Fund, so integrated care, which was number one on one of those slides in terms of issues that we need to deal with. And I'm going to say something briefly about the care bill, which actually wasn't even on the menu, which is interesting. So it'll be interesting what you make of that. But I want to talk about those two things through the vehicle of talking about whole systems reform and the particular importance of paying attention to what happens at system boundaries. So this is an argument that I use a lot. I can weave this into any talk that I do. But I fundamentally believe that public services are only about four things. They're about delivering prosperity, safety, health and quality of life. And any public service fits into that in some way. Some public services concentrate on one of those themes or just a couple of them. Some span across the board. But there is no single sector or single organisation that can deliver on any one of those themes of their own accord, because the agenda and the landscape is too complex. And that's what's driven the growth in partnership working for the last decade or so. Added to that, my experience is whenever you look at the barriers, the boundaries between systems, between professions, between functioning organisations, you always find a dividend. There's always something beneficial to be had looking at those boundaries. And if the organisational geography, the geography on which organisation and systems operate is also different, then the dividend is greater, but it's more difficult to get at. And I think that's why we, the people in this room, spend so much of our time looking at issues that are not within the capability or competence of our own organisations. So I spend most of my time trying to look at things that I can't actually do much about on my own. I can only do something about it working with others, and that's both organisations, systems, but also the public at large, which is a theme that runs through this agenda. So I think, so almost regardless of what sector you happen to be in today's health and care, people are talking about integration, and I realise there are a number of interpretations of what that word actually means. But if we were here now as a group of people looking at community safety and crime in London, if we were looking at growth, employment and skills in London, if we were looking at welfare reform, the same themes would come up. How do we organise public services around the individual? How do we commission for populations? How do we build personal resilience and independence? So this is a theme that's running through public services, and is something of our age. And of course, when we're in confident mode, we will talk enthusiastically and positively about our whole systems reform. Good, it's a good word, bit of jargon, Phil won't like it. But whole systems reform. But I think through, it's inevitable that to manage reform and to ensure that our change programmes have the right scope defined for them, we never actually reform the whole system. We only ever reform part of the system, because we don't reinvent the universe as much as we might like to do that. So I think it's particularly important that when we're looking at whole system reform, we concentrate on the boundaries of the systems that we're looking to change. Because if we don't, what we risk actually doing is not reforming the whole system, but simply creating a new bunch of integrated silos, which we'll then have to navigate across. And I think we just need to be conscious of that and cautious about it all the time. And I think that's our job as leaders. So that brings me on to the Better Care Fund and where we've got to in London. I'm not going to describe the mechanics of that because they'll be known to most of you in the room. I do think the Better Care Fund is a positive thing. I think it's potentially a powerful catalyst for change if we use it properly, and that's largely down to us. And the other thing I wanted to say is that in London, we've tried to use the Better Care Fund as a mechanism for bringing the various parts of the health and social care system together. So notably and rather pleasingly, we've just completed the assurance process for the first couple of plans. That was jointly managed by London Councils, NHS England and the London Social Care Partnership, which is largely Directors of Adult Social Services. So the feedback every area has got has come from that triumvirate. I think that's really been important, and it's been quite a positive experience, if I say so myself. So I think that's really important. So overall, the picture of London is pretty positive. I'll give you some themes that have come out of the headlines for London. Firstly, there are 33 plans, a full set, which is a bit of a prosaic point. But I know that's not true in the whole country, because I know that somebody somewhere was expecting 100 and something, they only got 100 and something less a few. So somebody either didn't send it to the right place or didn't do a plan. So every part of London's produced a plan. More fundamentally, London's plans are characterised by compelling person-centred visions, often based on the National Voice's I statements. There's clear evidence of collaborative working across the players in the system. There's comprehensive incorporation of the common ingredients of integration that the London Collaborative codified just before Christmas, and the interventions are well defined, so people know what they want to do and they want what they want to achieve from them. I also think, but this is largely anecdotal, that it's been really positive having a pot of money on the table. I'm a firm believer in this, because I think not only has that led to negotiation about how the money is used, but I think it's led people to be curious and inquisitive about where the rest of the money goes. And I think those are fruitful sort of discussions, and one of the things I think we should try to take forward in London is ways that we talk about each other's spending and money more effectively, in ways that we can understand, using a common language rather than the particular language of our sectors, which is one of the things that we tend to do. On the challenges side, there's more to be done to calibrate ambition and deliverability and the associated metrics. We need to be clear about the fit between BCF plans and CCG operating plans. We need to triangulate activity, money and impact. Is there really an impact there that's driven by the activity we're doing and the costs that we're incurring, or is it all made up? We clearly need to be sure that the acute sector and other providers are participants to the plans, and there's further development of financial arrangements, including risk sharing. So on the sort of fundamentals of do we share a common purpose, have we agreed our interventions, do we know where we want to get to? The answer is yes. I think there's more work to be done between now and the 4th of April about does the whole thing add up, basically, in all senses of that word, and does it add up for all of the players, not just some of them? So I think that's the work that will be going on between now and then. I want to go back to my theme of system boundaries. So the BCF's important, but it's a means, not an end. And actually, it's all very interesting and is creating a lot of activity for us all. But it's quite limited in both timescale and scope. So I guess it's likely to continue, and there's been statements to that effect. But actually, it's a one-year plan with a one-year leading. And I think the number is that it accounts for something less than 3% of the entire health and social care budget. So it is a catalyst, but it's not the be-all and end-all. And we mustn't get obsessed with our Better Care Fund plans and lose sight of some of the bigger themes. And I think some of those bigger themes are, and the first I've already mentioned, is what's the link between the Better Care Fund 2-year CCG operating plans and 5-year strategic plans. And it's worth saying at this point that local government in London very much welcomes the invitation we've had from our NHS colleagues to say be part of the 5-year strategic planning process and the assurance around that, because we need to plan across the whole health and social care system, not just the health system. So that's extremely welcome. The second is, and Anne's covered this, is that we have to make sure that our plans are not simply about reorganising the mix of health and social care provision, because it's got to be about prevention, early intervention, personal resilience, self-care and so on and so forth, because that's part of the mix that will deal with the financial equation. So we mustn't take our eye off that ball, and it's really good, hopefully you think so, that on today's agenda, there are issues around population health. There's a slot on population health, an important slot on that, and also about empowering the citizen, because these are important elements of the overall plan. The third is that by default, discussion tends to focus on adults, and clearly children are an important part of this agenda, in particular the transition from childhood to adulthood. You made that point to us in the feedback from October and said children seem to be absent from the agenda. So again, there's a slot on children's today. Finally, something that isn't on the agenda, the care bill. Because while we're redesigning the relationship between health and social care, in 2015, the social care system is going to undergo its most fundamental transformation since 1948. Councils will need to introduce national eligibility criteria, assess the needs of carers, develop a universal offer for information, advice and guidance, take responsibility for shaping the local care market, and a year later implement the deal not type care cap. So that's a massive agenda. Just to give you a scale, current estimates that this will cost London boroughs $750 million between 2016 and 2020, and that's before taking account of demographic changes. And of course that comes immediately after every council in the country will have lost 40% of its government grant between 2011 and 2015. So we've got quite a big challenge to address that level of reform within the financial envelope. But I actually think that's the lesser issue. I think the more important issue is that social care reform and plans for health and social care reform are largely going to affect the same populations, both in terms of resident population and workforce to a large degree. So I think there's an onus on us to make sure that we don't create two perfectly optimal silos around integrated care and social care reform, but we make sure we understand the implications and interactions between those two very major agendas. And I think that might be something we want to come back to in this forum at one of our future meetings. I'll end by saying, and this echoes something Anne says, that it's quite difficult to get such a broad range of people to come together. I thought the mix of people was rather good on the slide that Phil showed. We can only do that if we develop an agenda that is both pertinent and interesting. So thanks to the team that have put together an agenda that has brought you here, and I hope you're going to have a productive afternoon. Thank you very much.
Thank you, Martin. That's a very pertinent point, isn't it? That both healthcare and social care reform affect the same population and workforce. So if ever there was a pithy argument for integration, it's surely that.